Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony.
Well, in Region 1, as you know, we've had a spike in cases, but this is not in the whole region. We have identified a specific area, and that is around Quibana and in some of the neighboring communities. We have seen that increase in cases. So currently we have 62 active cases in Quibana, and as you know, we have implemented some lockdown measures in Quibana. We have medical teams that are on the ground. They have been going around to every household in Quibana, talking to the residents there, educating them on COVID-19, and also to help them to sanitize their surroundings. We have also set up the medical team there so that in case anybody deteriorate from maybe the mild form of COVID to a more severe form of COVID, that they will be able to detect this and take the appropriate action, which would require perhaps sending them to the hospital or in some cases evacuating them to Georgetown. So this has been an ongoing process, but we expect as we continue to monitor in Quibana that maybe in another week or two that situation would come under control. We'll start seeing less cases, and you know we'll be able to bring this spike under control. We noticed that some of the neighboring communities, however, that there have been a number of other cases around the neighboring community, and we have done some testing. We're going to continue to do testing, and the team has been deployed to provide coverage to those neighboring communities. So it is an ongoing process, and if additional support is required, we'll certainly send additional health personnel from Georgetown if that is required. But at this point, that is not required, and the team in Region 1 has been able to provide adequate coverage.
I noted that on the weekend you were in Region 2, and this is something you have been doing, checking in with the various regions. Some of what came out of Region 2 would have been, aside from the fact that the ventilators are now there and stuff, you are encouraging wider testing.
Mhm.
Do you?
Well, again, we have been doing these fact-finding missions to various regions because we want to get a sense of what is going on in the region, what are the challenges that health workers face, what are the challenges we have with the health infrastructure, supplies, and so forth. So at Region 1, we spent quite a lot of time talking to staff at both SUDI and the charity hospital. And we were able to get a better appreciation of how these institutions function. Both of these institutions, they are able to have hospitalized patients. However, one of the things that we noticed, we did not have so many persons who were in the hospital. And perhaps that was because of COVID, that people are not coming to utilize the services, or the doctors themselves have been taking extra precautions in not admitting people. Now, one of the things that we have said, and this is something that we have relayed to all the regional health officers, is that we would like to return our health services to some level of normalcy. And what do we mean by that? If it was restricted before, now we have to be able to provide such service. It is not only at the outpatient clinics, but also people who would need hospitalization. Many of the planned surgeries were deferred since March for not only in Region 2, but in several of the regional hospitals. So we are working on a plan. So during this month, we will return to planned surgeries for all of our hospitals, including the Georgetown Public Hospital. So you can imagine if we weren't doing planned surgery since March, that there would be an extensive backlog. And so, in discussions with the RHOs and some of the persons directly in charge of these departments, we are trying to figure out ways and means of how we can clear some of this backlog of cases. But this is an ongoing process, and we want to start that during November. Of course, we'll take all the necessary precautions so that um, people can come to the hospital and be safe, get their surgery, recover, and go home. So that's something that is ongoing. We also had challenges um, in Region 2, for example, with uh, persons there not getting adequate supplies of medicines. As you know, we have now bought an emergency supply of medicines, and during this week we'll be sending out a number of medications to the region. So hopefully it would satisfy the demand that they currently have, and we intend to stabilize the process so that they would have adequate supplies on a continuous basis. So this is something we are trying to fix. In addition to that, ARV drugs were short. We have now gotten supplies, so I was pleased to learn that they have already collected their supplies of ARV drugs. And so we are now trying to rectify some of the challenges that we have had in the system. And I am extremely happy that the medical personnel on the ground is assisting us. They've been very proactive in trying to get medicines back into the region, fixing up some of the laboratory services. So now we have to open up these services so anybody who is really sick can come to the hospital and get their service, of course, with the guidelines in place.
Another topic that wanted you to address. Recently, when you were talking, you spoke about the Eureka Medical Lab being able to conduct the tests. Could you guide us as to the criteria for institutions like those to be able to do that?
So far, there are only two institutions that are offering RT-PCR testing. This is the gold standard to test for COVID-19. And so these two laboratories, we have one in the public sector, which is at the National Public Health Reference Lab, and the other one now is Eureka, which is in the private sector. We know that there are many other institutions that have been talking to us about possibly setting up such services, but they have not been able to acquire um, permission from us as yet because there are various stages of setting up this service. What is required is that the ministry would have to send in a team to the facility to check exactly what you have, whether you have the PCR machine, whether it's working properly, whether you have the biohazard cabinets so that you can do extraction of samples. So all these things are specific laboratory processes we have to assess to see whether or not you're able to comply with these things. Then another very important component would be whether you have trained staff. Again, this is a very specialized process, and therefore you'll have to get the staff who understand how to do PCR testing. We have been able to train about 30 persons in the public sector to do this. However, I don't think there are many people in the private sector who would be able to offer these types of services. So, in licensing a facility to be able to do PCR testing, you will have to satisfy the Ministry of Health technical personnel that you have the equipment, you have the know how, you have the staff to be able to do this thing in the right way. And once we are satisfied that you have that capability, then we'll license you to be able to do those tests. But as of now, as we are speaking now, there are only two such labs. Um, and we would certainly be willing to work with every facility who has brought in the equipment and they are in the process of establishing themselves. We'll work with them to make sure that they are compliant with the guidelines and requirements uh, for PCR testing. But also want the public to know that unless such licenses are granted, that they must stick with those that are the ones who have been given the license. So don't get misled, so to speak. Um, Go to a licensed facility. You can have people who may be a little bit over exuberant and they have been advertising falsely. So people have to be aware of that. There are only two facilities right now that have been licensed to offer this testing. And the other thing I want to make very clear is that the testing that we are doing at the National Public Health Reference Lab, we are not charging a fee. That's free of cost. So anybody coming to the public system, you would not have to pay for such testing. So it's free of cost to the patient. So we don't want to hear complaints that people have been, going there and paying somebody to get a test done. If you, however, go to the private sector, well, obviously you'll have to pay in the private sector. But in the public sector, it's free.
Okay. Minister, just for information's sake, what is our capacity for testing now at the National Public Health Reference Lab?
We can probably do about 450 to 600 tests currently. And during this month, we want to increase that capacity. We are hoping to get to maybe 1,000 to 1,200 tests by the end of this month, or even more.
Okay. Moving over to another topic area, it's the 2nd of November, and so we have new guidelines. We noted that one of the changes is that the time was pushed back a little bit. Um, are you able to tell us maybe any feedback from the business community or so with regards to putting together the guidelines?
Well, I guess it's too early. It has just been a day or two since we have put these new guidance out there. But what is clear, not because we have increased the time, say, by an hour and a half, that means that you have to stay out an extra hour, right? If you don't have any business, you know, just go home. So these guidelines are there to facilitate maybe people who need to do things, but if you don't have any business out on the road or going to a shop, then go home. The idea is that in you know we are able to do business and at the same time stay safe. We have to get that balance because if we don't get that balance, we might keep everybody safe from COVID, and then we'll have economic collapse in the country. So there's a balance between the economics and the public health measures, and therefore nobody has really come up with the exact science of how you do this, but we know we have to balance the two, and that's what we're trying to do here to ensure that we can have the economy running while at the same time we're keeping people safe. So every person in this country got to think about public health measures. So when you're in the public, you must take those precautions. So you must keep your social distancing because, again, how is this virus transmitted? It's if you have an infected person and that infected person is able to reach somebody that is susceptible, meaning that They never had this virus before, so they have no immunity, and therefore, if they come in contact with somebody who is, who is infected, they can get the virus. To prevent that, if you stay your distance at least 6 feet away from an infected person, your chances are minimized. If you then stay 6 feet plus wear a mask, because when the droplets travel, they travel about 6 feet. Aerosols, if you're wearing the right mask, then it prevents you from getting infected. Most people, I think the message that we have been saying about mask wearing, I think most people by now understand the importance of wearing a mask or some form of protection on their face. However, we notice now that people might have something on their face, but they have the thing below the nose. The infection, actually, one of the ways that you get infected is when these particles enter your nose, goes into your upper respiratory tract, and then it would multiply there. So if you have on a mask and you cover your mouth and you leave your nose exposed, then obviously you can get infected. I see some people now, they have on the mask, but they pull the whole thing under the chin. So that's not protecting anything because your mouth is exposed, your nose is exposed, and therefore, if you have it in that way, then obviously these viruses can get into your upper airway, and again, you'll become infected. So if we want to stay safe, it is not just about wearing a mask for wearing a mask's sake. It is wearing a mask with the understanding of how you're going to protect yourself. And it means that you must wear that mask properly, covering your nose, covering your mouth, and especially when you're in crowded areas and when other people are around you, because you don't know who might be around you that are infected. So you have to stay safe, and that's one of the best ways of staying safe by wearing a mask properly. So we want to encourage people to do that. And if you comply with these measures, then obviously you will lower your risk. Sanitization of your hands are also important. We've been talking about hand washing, and the simple reason being because you can touch surfaces that might be infected, and therefore, when you do that, you can also infect yourself. So these are simple public health measures. Everyone can comply with these measures. And if you do them, then we certainly would be able to slow the spread, reduce the spread, and less persons would become infected. If we want to stop this epidemic in the country, then we have to slow the spread, and eventually, when there are less infected people, they wouldn't be able to pass it on to others, and that's when the whole epidemic would come to an end. But until then, we just don't know who might be asymptomatic. The thing is with COVID-19 is that there are lots of people who, before they get signs and symptoms, are infectious and can spread the disease. So during that asymptomatic or pre-symptomatic period, that's before you get any symptoms, you are infectious and you can be transmitting, right? So not because you don't have fever or you're not feeling fatigued, that doesn't mean that you're not infected. You can be infected and you can pass it on. So people need to understand this. And that is why the spread is so easily done. And which means that we have to take that extra precaution in wearing masks and keeping our distance. We're getting a little bit better, but I think there's still a lot of room for improvement. And you don't have to wait on somebody to keep repeating this to you. If you understand the message, you understand the reason why, then take the precautions because this is absolutely necessary, right? So I am once again appealing to everyone to take these precautions and let us slow and reduce the spread of COVID 19 in Guyana.
That's it for today's COVID 19 update. We've just spoken with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the ministry's website as well, health.gov.gy, and of course, our social media platforms.